Assalamu alaikum, the clinical day. First scenario, Mrs. Jackie, 45 years, came with complaint of hand pain. Vitals are normal. Please sit with her, examine her, and address her concerns. If you're ready, Dr. Phoebe and Dr. Najla, we can start.
Okay.
Yeah, here you
So,
go.
yeah. Okay. I am Dr. Gabala, the doctor in the medical unit for today. May I confirm that I'm speaking to Mrs. Jackie,
روح شوف أختك.
45 years old.
Yes, doctor. Yeah, I'm Miss Jackie.
Okay. Ms. Jackie, I have been asked to sit with you
بس
to
ارحموني كي قمنا.
examine you and answer all your concerns. Is this all right with you?
Yes, doctor, please do.
Okay, so Mrs. Jackie, can you tell me more what you brought you to the clinic today?
Yes, doctor. I have been. I had pain in my finger. For the last 3 weeks. It's getting worse, doctor. It's really affecting my life very much. So, yeah, I was thinking that it might go away by itself, but it sounds like it's getting worse.
Well, I'm so sorry for this, Mrs. Jackie. So can you tell me where is exactly the pain? Is the tips or proximal part of your fingers, or where is?
It's my middle finger, doctor. Like the by the end, about just in the middle of my middle finger. It is swollen and painful.
I'm so sorry for this. Can you score the severity of the pain?
It's 6/10, doctor.
Okay, and it is the first time.
Yes,
It started gradually or suddenly,
it started gradually, doctor.
increasing or decreasing?
No, it's increasing. It's getting worse.
Anything make it better or anything make it worse?
I don't think there is anything that makes it better. No.
Can you tell me if there is any stiffness early morning when you wake up from sleeping?
Yeah. I feel like the stiffness most of the day. It's not only in the morning.
But not in the morning and then disappear.
No.
With movement or using your hands, the pain is more or no?
Yes, it get worse by movement, and I feel it. Yeah, it is worse in the morning. The stiffness, especially, but the pain.
Mhm.
I mean, the pain is ongoing all the day. It's not only in the morning.
Okay.
So the stiffness in the morning, but the pain is ongoing.
The stiffness in the morning,
Yes,
mainly.
yes,
Mainly in the morning, not all
yes.
the day.
No,
Okay, and
the pain all the day. Yes,
okay, the pain all the day and the stiffness in the morning. I'm right?
yes.
Okay, it increased with rest or relieved by rest?
I don't feel like anything makes it better. Doctor, it's ongoing all the time. The pain is there
Okay,
all the time. Yes.
okay. Any other joint pain in your body?
Not recently, no.
Mm-hmm. Before there is?
Before, yeah, before my shoulder was hurting me.
Mhm.
Like yeah, like 4 or 5 weeks ago, and I consulted. I saw my GP, and he didn't find anything significant. So, I was on ibuprofen, and
Mm-hmm.
now I feel it is much better.
Mm-hmm. In both your hands, right?
No, it's just one hand, my right hand only.
Your right hand only. In
Yes.
all fingers,
No, just the middle finger.
just the middle finger.
Yes.
Oh, okay. And this ibuprofen, when you took for the shoulder,
Mm.
is make it better and
No, I
improve.
don't. No, I don't think it is touching the pain. No.
Any muscle pain?
No, doctor. But I
Okay.
feel tired overall. I'm feeling tired.
Hmm. Any muscle pain?
No.
Okay. Any muscle weakness when you comb your hair or uh, when you um, uh, when you get upstairs?
No weakness.
Okay. Any history of trauma?
No.
Any fever?
Yes, doctor, I feel hot,
Mm.
but I didn't measure it.
Okay. Do you have any infection in your hand or any area of the body recently?
No, doctor.
Okay. Any skin rash or skin changes?
Yes, doctor. Yes, I have skin changes in my face, like for 4 weeks maybe, but it's getting much better now.
What is this changes or rash? What
I feel
happened?
like there was redness in my cheeks and my nose, but after I consulted one of the pharmacists, he prescribed an ointment for me, and I feel it is getting it much better now.
Okay. And there is any hand pain before?
No, doctor.
Okay. Okay. Any mouth sores?
No,
Any tightness of skin?
no,
Okay. Any change in the color of your nails when you exposed to cold?
no, doctor. No, I didn't notice such a thing. No,
Any electric sensation in your hand increased at night?
no, doctor.
Any history of blood clot?
No, doctor.
Any history of the pregnancy loss?
No.
Any shortness of breathing?
Yes, doctor. Yes, I have shortness of breathing. Yes, you are right.
Okay. It is on exercise or at rest?
Not at rest, no, but yeah, on exercise. When I exert myself, I feel like shortness of breathing.
For how long?
It's for the last couple of weeks, maybe 3, 4 weeks.
Hmm. Okay. Any it increased at night or you awake gasping for air?
No, doctor.
How many pills you use during sleep?
Normally, doctor, just one pillow.
Okay. And there is any problem in swallowing?
No,
Any loose motion?
no, doctor, no. It's hard motions.
Hard
Yes,
hard motion.
yes,
Okay. Any weight changes?
yes, doctor. Actually, I lost weight recently.
Hmm. You lost weight.
Yes,
Okay. And how many kilos?
it's about 5 kilos, doctor, over the last 5 weeks.
Okay. And it is intentional or no?
No, not at all.
And the appetite?
My appetite is fine.
What? Sorry?
Fine. My appetite is fine.
Fine.
Hmm.
Okay. And okay. There is any weather preferences?
No, doctor.
Okay. Any lumps or bumps in your body?
No.
Any night sweats?
No.
Any feeling sick or being sick?
No.
Okay. Can I ask you if you have any past medical history that I should be aware about it?
Mm, no, doctor.
Okay.
Yes.
Any medication?
No. It's just
Any,
ibuprofen and every now and then, just that.
okay. Any blood transfusion?
No.
Any sorry, any hospital admission?
No.
Sorry for asking, any recreational medication or
No,
drugs?
doctor. No, doctor.
Okay. Any recent travel history?
No.
Okay. Any sharing needles?
No.
Any unprotected sex? Sorry for asking this.
No, doctor.
What about your period?
It's fine.
Married or no?
Yes.
Have kids?
Yes, I have 2 kids.
Last one?
Last one.
Yeah.
Sorry. I have 2 kids.
Okay. And any birth control medicine?
No, doctor.
Okay. Okay. So, what about your mood?
Um, I feel I feel a little low recently because I'm always tired, and my shoulder was hurting me, and now my finger is hurting me. I don't know what is going on, doctor.
I'm so
And
sorry for this.
thank you very much.
Okay. And did you measure your temperature when you feel hot?
No, doctor, no, I didn't measure it.
Okay. And there is any uh, no recent infection anywhere in your body?
No,
Okay. Do you drink alcohol?
only occasionally.
Smoker?
No,
Sorry, do you smoke?
no, not at
Oh,
all.
okay. Uh, okay. So can I examine you?
Yes. Okay.
Okay.
Yeah. Okay.
Okay. Before examining, can I ask you one more question? Do you have
Yeah.
any heart racing?
No.
Anyone told you that you have become paler than before?
No.
Okay. I will examine the hands.
Mm-hmm.
Any changes in the face or the appearance?
Uh, no.
Okay. And in the
It's
hands, mm,
mm-hmm. It's just the
uh,
rash in my face, nothing else. I can't share here. I will share it in the WhatsApp group. Okay. Mm-hmm.
yes, please. Yes. Okay. And in the hands, there is any swelling or any deformity or any clubbing
I
or
feel
any
my
needle
finger
changes?
is swollen, doctor. My finger is swollen, my middle finger, but no changes in the nails.
Okay. And okay. And I want to feel if there is any nodules on the back of the elbow or forearm.
No nodules, no.
No skin tightness. I will pinch the
Mm,
skin.
no.
Okay. And then I want to feel both hands for the temperature.
No temperature change.
Okay. I will examine this joint for swelling and also tenderness.
It's very tender, doctor. Sorry.
Hmm. Okay. And is there is any crepitation in the wrist?
Rest of fingers, you mean? No, no crepitation.
And لا the wrist joint itself.
No, no. Wrist joint,
Okay.
wrist. No, no, no crepitations. No.
Uh, Tunnel test.
Normal.
Okay, I want to examine then vitals also, please.
The vitals were normal. Blood pressure is fine. Temperature normal. All
Mm-hmm.
vital stables. Yeah.
Okay, and then the eyes.
Normal.
Mm-hmm. And I want to examine the mouth.
Normal.
Okay, and I want to examine the neck for any lymph node or any thyroid gland.
Normal.
Mm-hmm. And then the shoulder also, the left shoulder, any crepitation or any restriction of movement or tenderness.
No, it's fine.
And
Full
for
range.
the chest, I want to examine for the breathing sound and if there is any crackles.
2 minutes
Yes,
left.
there is fine crepitations in the upper zones of the lungs.
Upper zones.
Yes.
Okay. Okay. Um, okay. And also, I want to examine if there is any hepatomegaly or splenomegaly in the abdomen.
No organomegaly.
Mm. There is
السلام
any
عليكم ورحمة الله
there is
وبركاته.
any cough or noisy chest.
It's
Ah,
the cough, no cough. It's occasional dry cough, doctor, but
Okay.
yeah, yeah. On examination, there is crepitation, fine crepitations.
Okay. Uh, okay. And there is any rash in the lower limbs.
No,
Okay. So for the dry cough, for how long?
it's just recently. I feel it is not bothering me, doctor. It's just like on and off for the last 4 5 weeks as well. But it's not something that is bothering me. It's the shortness of breathing that it makes it's it scared me more.
Okay. Okay, what's your concern?
What is going on with me, doctor? Do I have a cancer?
I appreciate your concern, and there is the many possibilities in my mind right now. So we will do some investigation and images, and one of the possibilities is inflammation in your many parts of your body, including the joints and lungs, and this is called sarcoidosis. Don't bother by the medical terminology. Other possibility is one is called the systemic lupus erythematosus, and this is another differential diagnosis in your condition. Also, this is inflammation due to abnormality in the defense system. As I told you, we will do some investigation, including blood test and also the images, and we will include specialty doctor, including the joint doctor and the chest doctor, and we will be back to you. Is this okay?
Yes, doctor.
Yes.
Yes. Thank you.
Time is
No.
up.
Okay, thank you.
Okay. Examiner questions?
So present your case.
Okay, Mrs. Jackie is 45 years old. She presented with middle finger swelling, joint swelling and tenderness, and also she has shoulder pain since 2 weeks, and also she has dry cough. She has tiredness, and also she has rash in her face. By examination, there is tenderness and swelling in the left middle finger, swelling and also tenderness. And by examination of her chest, there is crackles in the upper zones. And otherwise, I can't appreciate any other signs in the examination. So, in the view of this, I can conclude that in my mind, there is three differential diagnoses. Actually, it may be sarcoidosis or systemic lupus erythematosus or osteoarthritis.
Mm-hmm. 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 That's good. So what is with sarcoidosis in your history and examination?
Yes, in sarcoidosis, I can find that there is the malar roche, which is not sparing the nasolabial fold, and also there is dry cough and crackles in the upper zones, and also history of tiredness with joint pain in the shoulder before. So this may be in consequence with sarcoidosis.
Okay, so how you'll investigate your case?
Uh, First of all, I will do basic tests, including CBC, CRP, ESR, rheumatoid panel, including the rheumatoid factor and the ANA, and also calcium ACE level for sarcoidosis, and also anti double strand DNA antibody, anti-Smith antibody. And I will do also X-ray on the shoulder and hand, and I will do also uric acid to exclude gout also as maybe a cause, and I will run also investigation for complication like chest X-ray, high resolution CT scan. If sarcoidosis is suspected, we can do bronchoscopy and biopsy. Also, we can do ECG and echocardiogram, renal function test, liver function test. And for treatment, including the non-pharmacological patient education and health counseling, and also some we can give some non-inflammatory, non-steroidal anti-inflammatory for the pain, and also I will involve a multidisciplinary team involving the joint doctor and the chest doctor or pulmonology, and specialized nurse, occupational and social supporters, and also I will if sarcoidosis, I will give her steroids, and if systemic lupus is a diagnosis, so I will give her maybe chlorohexine or adalimumab
What is
for the joint.
chlorhexidine? What is chlorhexidine?
لا لا سوري كلوروكين.
Hydroxychloroquine.
hydroxychloroquine, sorry yes.
Okay. 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 That's good. So are you going to admit this patient?
Right now I think no need for admission for this patient because she is vitally stable, no fever, so we can do the workup from outpatient.
Mm-hmm, 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 mm-hmm. The patient is telling that she has got constipation. Her mood is low. If you ask, she will tell that she had tummy pain. Are you all these symptoms? Does it direct you towards anything?
Loose motion,
Hard motions,
hard
hard
motion.
stool,
I
hard
forget
stool.
this. Yes,
Yeah.
yes. I forget this already.
Mm-hmm.
Direct me to uh, um, with this flushing joint pain and okay, I don't know.
Okay, patient with sarcoidosis is are they have did you suspect any electrolyte imbalance in patient with sarcoidosis?
I think hypercalcemia.
Yes.
Mm-hmm.
Yeah. So putting hypercalcemia in
Yeah,
mind, would you?
hypercalcemia with constipation. Yeah, maybe
Yeah.
something
So
with
is
hypercalcemia.
this
Yes.
will change your plan of management in any way?
For hypercalcemia, yes, we can give, I think, good hydration for the patient, and
Mm-hmm.
we at that time we can admit her for good hydration,
Mm-hmm.
and diuretic, I think we can give
Sorry?
diuretics for hypercalcemia, like thiazide
No.
diuretic.
No, no, no. How you manage hypercalcemia?
By good hydration. This is
Uh-huh.
the first,
Yes, and then?
and I'm confused.
Mm-hmm. Okay, you did
Okay.
great. You did, yes, you did well. So for hypercalcemia, it is hydration, IV fluids, and um, bisphosphonates, um,
Calcitonin, maybe.
bamidronate.
Yeah,
Yes,
yeah.
bamidronate. Yeah, for hypercalcemia. This is the only indication for admission of this patient because she has got symptoms of hypercalcemia. So you need to keep her and check for the calcium level. If it is more than 3, you
Mm,
need to admit her for correction of calcium.
mm,
Yeah.
mm.
Okay. Thank you
Okay,
very much.
okay. Thank you.
Okay, thank you, Dr. Najla, for the case. I don't know,
It is
still,
the
still unknown the diagnosis. Let's hear Dr. Najla comment first.
it is a gift for Phoebe, by the way, because I know she knows sarcoidosis very much. If I know the one who will do the case with me is Phoebe, I would change it, but I already prepared it, and the last minute I knew that this is
Yeah,
you,
I
so it is
remember
a gift for you.
we have done this case last week, right? The same
She,
sarcoidosis.
she gave me with another presentation.
Ah, she gave you. Now you are
Yeah, yeah,
returning the gift. Okay.
yeah. Yes. So,
So,
so yes.
Yeah.
So you did well. Mm-hmm.
yes, your comment, please.
Baby, you did well, but I felt like you took long time in the analysis of history presenting illness. Although the patient past medical history is fine, or I already gave you the shoulder pain, and yeah, I gave it by myself, but you took long time in analysis of history of presenting illness. I feel this is
Mm,
really hazardous. Take care. And
mm,
yeah, the systemic review, I felt like you are jumping here and there. I didn't felt like you are having a sequence in questions like uh
Yes, because I'm confused about the case
yes,
really.
yeah.
Mm,
So yes, so just try to two, one or two question in each system,
mm,
because the case has a lot of positive findings, because sarcoidosis is just affecting everywhere.
yes.
So yeah. Other than that, you got the diagnosis. Your differential diagnosis was perfect. Because this rash, it could be SLE or sarcoidosis in the top, and SLE is a differential as well, plus lupus vulgaris is a differential as well. The patient used,
Mm,
I mentioned to you that the pharmacist prescribed an ointment for me. You didn't ask what is this ointment. So the patient used hydrocortisone ointment. That's why the rash is started to respond,
mm,
because the lupus pernio rash
yes.
treated with
Mm.
with steroids.
I suspected that the pharmacist
Yeah.
gave steroid or
Yes.
sunscreen
Yes. So you
to
needed to ask what you
us.
used
Yes.
exactly.
Mm,
On the other hand, investigations. Yeah, I feel like you did well. You did all the investigations needed. You just missed the hypercalcemia, but I think you will not never forget it again.
yes. Yes.
Yes, and you should include the dermatologist in your team.
Multidisciplinary team. Yes. Mm,
You should refer this patient to dermatology as well, for this rash. Other than that, I feel so. What is the lesion in the finger? What you call this lesion?
in the finger.
Mm-hmm.
Uh,
What's
I don't know.
mm-hmm. So this is dactylitis. Actually, this is dactylitis, like sarcoid granuloma formation in the in the fingers. It's typically coming in the fingers.
Okay.
Yeah, and it got a like a characteristic changes in the X-ray.
Okay.
Yeah,
Mm.
but you did well. You did great.
Yeah, I don't
Well
know
done.
actually that sarcoidosis may cause like a swelling and deformity.
Because
Yeah, this is the first time for me to know this.
yeah, it is called
Mm.
sausage fingers. It's just like destruction.
Is that
Yeah,
like that of scleroderma or dactylitis like this?
it's the same dactylitis. Yeah, it's called
Yeah.
dactylitis. Yes, it's swelling and inflammation of the finger.
Mm.
Making them looks like a sausage digits.
Okay.
Yeah, it's
Mm.
also common in psoriatic arthritis and tuberculosis.
Yeah. Mm. Mm.
It's a granuloma formation in the bones of fingers.
Okay. Very good case. Thank you very much.
You are welcome.
Thank you.
Okay, well done, Dr. Phoebe. My comment also starting from the analysis of complaint. You talk long. Yes, you are
Yeah.
confused about the complaint and the analysis of the complaint. I didn't also know is it mechanical or inflammatory.
Mhm.
I was confused like you. But if you feel yourself confused, leave it. Leave it and go to the associated or the past medical history. You might get another clue because you cannot
Mm.
know the diagnosis from the analysis
But
only.
yeah, but Dr. Basim, because also يعني if there is a crackles and this rash in the face, so I wanted to know is this mechanical or inflammatory or what is
Actually,
this?
it's
Because
supposed to be clear. I don't know
yeah,
till now. Is it mechanical or inflammatory? Dr.
I
Najla, please.
think it is inflammatory.
Inflammatory,
Sarcoidosis is
yes, it's inflammatory
inflammatory. Yes.
from
But
granuloma. Yes, granuloma
but
formation in the joints.
Dr. Najla, you said
Yes,
it's worse with the movement, and this is
it's
again it's inflammatory.
it's
Because this is
morning
not
stiffness.
rheumatology. Mm.
Sorry.
Because this is not rheumatology, not rheumatological.
So
Rheumatological, I think,
suppose
is the
mechanical.
own.
If you mean mechanical, it will be worsen with the movement,
Mm-hmm,
right?
mm-hmm.
I think Dr. Basim. I think it's inflammatory, maybe stiff also because this is inflammatory, but it is not rheumatological, so it will not take the same pattern of rheumatological. I
Yeah,
think so.
I believe if there is soreness or inflammation and granuloma in the joint, it will be mechanical. I don't know.
Mm, mm. But that I know that
It is
sarcoidosis
inflammatory.
is inflammatory.
Yes, it is inflammatory. Occurs due to granuloma formation. Inflammation is affecting the bone. It worse in the morning. It's worse in the morning and improves with movement. May be associated with warmth and redness as the joint. Um, yeah, you will show changes on the X-ray. So yeah, so sorry. Maybe I confused you with the history of the joint, but it is there is stiffness.
Mm-hmm.
But
Yeah.
it will not be the stiffness for a long time as the rheumatoid. I
Yes.
think so. It's not inflammatory to that extent, the same as for rheumatoid. This is my belief. The other thing, 4 minutes to analyze the complaint will take time from other system and other clues. You have other clues in this scenario. And
Yes.
while you are doing systemic review, as Dr. Najla said, you are going in a random way. It's not regular.
Mm-hmm. Yes, I know
And
this.
yeah, because you are confused, you don't know the case.
Yes,
But
yes,
we are here to train ourselves how to take systemic review in a good manner, systemic manner from head to toe without jumping from here to there.
yeah,
Okay. And
yes,
I mentioned before the question for every system, the common question for every system, you can do it in 2 minutes only. And in
mm,
this case, you will have 2 to 3 finding in each system. That's why you miss the racing of the heart and you ask about it at the end, which is
yes, yes,
yeah, it's not also
Mm.
it's
mm,
not good in your performance. I think you were confused, and the confusion make you also this I don't
disorganized.
yeah
Yes,
totally
mm,
disorganized.
yes,
This is my comment today. I wrote some comments about the jargon while explaining. You said inflammation of the joint, so you have to say there is soreness in your joint, soreness in
mm,
your. And I have another question for Dr. Najla. This is like
Mhm.
mallar rash. Why you said this is lupus pernio? The lupus pernio looks like different.
Yes, the patient used some medication on it, so it's a little changed. I got the picture from Google. Actually, I
Mhm.
asked for lupus burnio, but
Uh,
it's
yeah, I guess it was
why you
some
miss it. Why you think it is Muller rash?
because
There's involvement of the
it's
nose. Hmm.
involved or sparing the nose. I will see it again.
It's
Renew, I
involving the
think,
nose.
involving, yeah,
Yeah,
involving the
involving the nose.
nasolabial
Yeah.
fold. Yeah.
Yes, and the nasal folds. That's why it is. Yeah, this is lupus burnio.
But anyway, other thing, Dr. Phoebe, you miss during analysis of the system and the female history, you have to ask about any miscarriage. If you suspect something
No,
related,
no, I
Asked
asked
about
about,
miscarriage. Yeah, she asked
I
about
asked
miscarriage.
any loss of pregnancies.
Yeah.
Yes.
you said pregnancy, you didn't say miscarriage.
No, no, I asked her any loss of pregnancies before,
Mhm.
pregnancy loss before.
Okay,
Sorry.
sorry, I didn't hear it. Okay,
Mhm.
okay. Apart from this, yes, as examination steps, yeah, you examine from the hand and always do look, feel, move.
Yes.
You didn't do the movement and the function, right?
Movement more, yeah, because the
You
time,
didn't do.
because of the time. Yes.
You know, but this is the main complaint. If you will
Yeah.
examine, you will if you examine something
Mm,
in this scenario, you have to examine the joint, which is the
yes.
main complaint. You will take longer time in the joint, even if you miss other system. So
Mm,
yes, you can examine the chest, you will examine the heart, you will examine the rash, but you have to examine the joint properly. Look, feel, move.
mm,
Okay,
mm,
all
mm,
steps you train yourself to do this in any joint pain. Look, feel, move, especially in the hands. Okay, carpal tunnel
yes.
also you offer, which is good. I think this is my comment. But the case again, the presentation and the mechanical or inflammatory, I'm not sure if someone has also confirmed about the presentation of sarcoidosis as joint pain to be inflammatory or mechanical. For me, I guess it will be uh, mechanical because of the granuloma. Anyway, we can hear about it or we can read about it to explore more. If
Yeah.
someone
Okay.
has comment, please he can add. And Dr. Phoebe, please write your case to Dr. Najla.
Yes. Okay, okay, of course.
Okay, and Dr. Ibrahim said it's inflammatory. So the inflammatory will be worse with rest. This is against the presentation. That's why I was confused. So it's supposed to be worse with rest. Whenever I take rest or sleeping, the pain is worse, and whenever I move, the pain is going or subside. Okay, clear now.
The scenario is in the chat box, okay?
Okay, thank you. Yes, so it will worse with the rest. I think it will give us a clear presentation of the case. So it will be inflammatory pain, not mechanical. The description by Dr. Najla going with mechanical one. That's why it confused all of us. Okay, the case second scenario, Mrs. Dahlia, 30 years old with chest pain for 1 day. I will give you 2 minutes, then we can start, okay? We can hear sorry, you can read the comments. Yeah, there is good question for indication of steroid and sarcoidosis. Neurosarcoidosis, I think someone wrote it. Neurosarcoidosis, hypercalcemia, stage 3 and 4 in the chest or pulmonary. And I think there is also Lofgren syndrome, or this is another indication. Differential of face rash and crackles, SLE, yes, Malar rash, sarcoidosis, Dr. Mohammed Sardar, thank you. Lupus pernio, systemic sclerosis, Malar rash from pulmonary hypertension, mitral stenosis as well. Okay, indication as Dr. Ibrahim wrote, lung infiltrate, yes, cardiac sarcoidosis, neurological, ocular, hypercalcemia, exactly, lupus pernio. It was misleading history, I guess so, yes. She didn't check for erythema nodosum, I think. Yeah, but I think she asked about any skin rash. Okay, some paper here, document, joint, less than 1%, symptoms, pain, stiffness and rigidity, swelling sometimes with red coloring. But also it didn't explore what the nature of the pain. Okay, let's assume it's really inflammatory, so it will be worse with the wrist. Okay, Dr. Najla? There will minus you if there is no indication to steroid here for sarcoidosis. No, there is indication. Hypercalcemia itself is an indication for it. Okay. Okay, let's move to next scenario. If you're ready, Dr. Najla, we can start. That's why I went with sarcoidosis. Yeah, I believe you did great when you said sarcoidosis. If me, I would say systemic lupus. I didn't think at all about sarcoidosis. I thought it's no, sorry, not systemic lupus. I thought it's something mechanical like gout or osteoarthritis, but also I couldn't link it with the rash in the face. But again, let's learn the lesson. Sarcoidosis joint pain is inflammatory one, so we have to know it will worse with the rest, and it will improve with the exercise. Even it will associate with the stiffness, but it will not last longer like rheumatoid arthritis. Stiffness, clear? Sarcoidosis is inflammatory, but I think lupus pernio common affect the nose. This is also what I suspect, Dr. Rasha. Uh, I, I, I remember it will affect and it will cause also deformity to the nose, not as a redness, not at in the picture. Yes, I agree also. Okay, but if there is hypercalcemia in the scenario, yeah, if there is hypercalcemia, this is indication for steroid. Ready, Dr. Najla? We can start.
Yes, I'm ready.
Okay, here you go.
Okay.
Hello.
Hello?
Hi, I'm Dr. Siddiq. I'm one of the doctors working today. May I confirm that you are Miss Dahlia, 30 years old?
Yes, doctor.
Yes, hi, Miss Dahlia. So today I would like to discuss with you about your health condition. I would like to examine you, and by the end of the consultation, I'm happy to answer all your concerns. Is that okay?
Sure, doctor.
Yeah. Okay. So, Miss Dahlia, can you please tell me what is going on with you?
Yes, doctor. Actually, I suffered from chest pain for 1 day, and I'm really afraid if this is something serious.
Mm-hmm, mm-hmm. Okay, I appreciate your where is Miss Dahlia? Just if you can just please explore to me more, so we can reach to the bottom of this condition and set a management plan together. So please tell
Yes,
me more about this chest pain. When it started, how it started.
yes, it started, doctor. I can't see gradually. No, it's mostly suddenly, and I feel like tightness and dull aching pain in my chest. Uh, since 1 day, doctor.
Okay, so for okay,
For
so
1 day, yeah.
where in your chest exactly?
It's in the center of my chest and left side of my chest also, doctor.
Okay, and you mentioned it started suddenly. Can you describe it for me?
Yes, doctor, it is like dull aching and like tightness in my whole chest.
Does it move elsewhere in your chest or in your body?
No,
Does it touch your shoulder or your neck or your jaw?
both shoulders, doctor.
Shoulders.
No, it's graduate. It's like it travels to my shoulder, but the main in the chest, doctor.
Okay, so it is mainly in your chest and it moves to your shoulder, right or left shoulder?
My both shoulders, doctor.
Both
All
shoulder.
all the area from up down, doctor. I have the chest pain and tightness. Yes.
Okay, okay, okay. And do you feel any sweating with this chest pain?
I feel hot, doctor.
You feel hot.
Yes.
Okay. Do you feel any racing or pacing of your heartbeats?
Yes, doctor. Yes, you are right. I have racing of my heartbeats like it's rapid heart beating, doctor.
And since when?
Same time, doctor, for
The
1 day
same.
also.
Okay.
Mm-hmm.
And is the pain since it started, is it getting better or getting worse?
Worse, doctor.
Okay. And if I ask you to score it from 0 being no pain and 10 being the worst pain ever, how you score it?
Like 6, doctor, to 7.
Okay. Any shortness of breathing?
Yes, yes, doctor.
Okay. Any cough?
Mm, yes, but not too much.
Okay. Since when the cough started?
Since few hours back, doctor.
Few hours back.
Yeah,
Okay. And how is the cough? Is it dry or wet cough?
dry, doctor.
Have you ever brought any blood in this cough?
No.
Okay, okay. So, Miss Dahlia, are you known to have any medical condition before?
Yes, doctor. I have, I think, blood problem.
What do you mean by blood problem?
Blood disease, doctor. I was diagnosed since long time that I have blood disease in my cells of the
Mm-hmm.
blood.
Are
Yes.
you taking any medication for that?
No.
And how you are diagnosed with this blood disease?
They do for me some blood test, doctor.
Because you had any complication, like any complaints or any symptoms?
Yes, like I have before shortness of breathing, fatigue, and they told me that do for me some blood test, and they told me that I have a blood cell disease.
Mm-hmm. Are you taking any medication for that?
No.
No medications. Any blood transfusion?
Yes, occasionally, doctor. Not regular, but sometimes, yes, I have blood transfusion.
Okay. When last you had this?
1 month back.
1 month back. Okay. Okay. Is there anyone in your family has the same condition like yours?
I'm not sure, doctor, but in my brother and sister, no.
Okay. Any other illness run in the family?
No.
No. Okay. Have you ever had a blood clot, Miss Dalia?
No.
No, not at all. Okay. Okay. Miss Dalia, anyone told you that you look more pale than usual?
Yes, I'm usually pale, doctor.
Okay. Do you feel tired more than usual?
All the time, doctor.
You are tired all the time.
Yes.
Okay. Any weight loss?
Uh, no. Same.
Any appetite changes?
No.
Do you have any weather preference?
No.
Any lumps or bumps in your body anywhere?
No.
Okay. Okay. So, Miss Dalia, just a couple of quick questions. Do you have headaches?
No.
Dizziness or blurring of vision?
No.
Any throat pain or cough or
No.
you mentioned you have cough, yes?
Yes.
No.
Cough, doctor.
Okay. Okay. Any difficulty swallowing?
No.
Okay. What about your tummy? Any aches?
No, doctor.
Any acid brush?
No.
How's your bowel motions?
It's good, doctor. No problem.
What about your water work?
Normal.
No frothy urine or change in urine?
No.
No.
I forget to tell you, doctor, that I have some skin pigments in my lower my legs. Some darkening in skin of my legs.
Darkening in the skin of legs.
Yes.
Okay. Any itchiness?
No.
And since when is this darkening?
Since few years, doctor, or I can't remember, but long time, not recently.
Is it getting better, getting worse?
No, no, no.
No. Okay. 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 Miss Dahlia, um, what do you do for living?
I'm a housewife, doctor.
Okay. Are you smoker?
No.
Do you drink alcohol?
Occasionally, doctor.
Mm-hmm. Mm-hmm. Okay. And by any chance, is this condition affecting your how is this condition affecting your life and your daily activity?
I- I'm usually tired, doctor.
Mm-hmm. 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 Okay. Okay. Are you on regular follow-up with blood doctor?
Yes, yes, doctor. Yes.
When last you saw them?
1 month back when I got my last blood transfusion.
Okay. Okay. Any plans for further blood transfusions near time?
They didn't tell me yet.
Okay. So, Ms. Dalia, sorry for asking. I would like to ask you some private questions, part of my assessment. How is your periods?
It's regular, doctor. No problem.
Okay. Do you have kids?
No, I recently married.
Okay. 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 Ms. Dalia, I would like to examine you if you don't mind.
Sure, doctor.
Okay, so I will start by hands, fingers. Any changes?
No,
Beatings of the nails,
no,
leukonychia, no. Palms, any
no,
palmar erythema?
no. Only Balor, only.
Okay, pulse is fine, regular.
Pulse 95.
95. Regular?
Mm-hmm. Regular.
Okay.
Temperature is
Vital.
temperature is 38.
Mm-hmm.
Blood pressure is 100 over 60, and O2 sat is 93 to 94.
Okay. Okay. Ms. Dalia, have you had any his hospitalization or surgeries before?
No.
Okay. Okay, so I will check on the eyes. Pallor, other than pallor, jaundice?
Yes. Valorant Jones.
Jaundice, okay. Mouth changes, no, tongue and mouth. Any cyanosis or
Only Valor.
only pallor?
In the
Okay. Okay, so I will palpate the neck nodes, lymph nodes in the neck.
No. Nothing.
No palpable lymph nodes.
No.
Okay. Okay. So I would like to examine the cardiovascular system. Um, apex beat.
It's normal, but there is hemic murmur.
Hemic murmur. Okay. I would like to no other murmurs.
No.
I would like to examine for the chest, upper and middle lower zones.
Yes, there is scattered wheezes and scattered crackles.
Okay. Okay. So I would like to examine the abdomen, the liver.
Not palpable.
You mentioned wheeze and crackles, yeah?
Yeah.
Okay.
Scattered. Mm,
Okay. The liver not palpable. Spleen,
Not palpable.
any ascites.
No.
Show me the rash in the lower limbs.
It's just some darkening.
Dark. And how is her color? Is she white or black?
No, like darkening other than the other areas.
I mean, Miss Dahlia. Is she okay? Okay, darkening. Is any thickness or
No, nothing, nothing.
okay.
No. And also some darkening in the creases of the hand also.
Creases of the hands.
Mm.
Okay. Any postural drop in the blood pressure?
No.
No postural drops. Okay. 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 So I finger the toes. Any changes in the toes?
No.
Okay. So Miss Dahlia, what is your just before asking your concerns, you mentioned you have shortness of breathing. Is it related to exercise or sitting position?
It started with this tightness and chest pain, doctor. With
Mm-hmm.
this hotness in my body, and I feel hot.
Mm-hmm.
Yes, and this cough. All the symptoms come together, doctor, suddenly one day.
Okay. So do you manage to lie flat or you prefer sitting?
I'm not sure, doctor, about this.
Okay. Okay. So you mentioned you are concerned of having something serious. Do you have any other concerns?
No.
Mm-hmm. Mm-hmm. Okay. Okay. So
Two
Miss
minutes left.
Miss Dahlia, um from what we have discussed and from examination, I believe you had a condition called hemochromatosis, which is basically excess iron in your body, which accumulates in your skin, giving you this darkening skin in your legs, and it accumulates in different parts in your body. And for the chest pain and the shortness of breathing, the fact that you are being low, your blood is always low, might be contributing to those symptoms of tiredness and shortness of breathing. Are you following me, Miss Dahlia?
Yes, doctor, I'm following you.
Yeah. So for that, I would like to keep you with us. I would like to run blood investigations and images, and I will involve a group of specialists in your management, and I'm happy to sit with you again and discuss the plan of management. How this sounds to you, Miss Dahlia?
Okay, doctor. Is it serious, doctor?
Actually, Miss Dahlia, it is serious, but it is a treatable
Mm.
condition because excess iron in the body might, as I mentioned, might accumulate or might deposit in different parts of the body. Uh, so it needs to be treated it well. So it is serious but treatable.
Mm-hmm. Okay, but not heart attack, doctor.
You might have, yes, the low bloods is making your heart working harder. So you are showing some symptoms of heart. We can call it like heart failure. We can say, but it's early for me to tell by for sure what is going on. I need investigations and jelly scan to your heart and images, X-rays to your chest to find out what is going on exactly. How this sounds?
Oh, yes, sure, doctor. Thank you very much.
You are welcome.
Okay, time is up.
Mm-hmm.
You can
Okay.
start examiner.
Yes. What's your finding, doctor, in this case?
So I reviewed Miss Dali. She's 30 years old who came with chest pain, dull chest pain, for the last 1 day. Um, Apart from that, she mentioned shortness of breathing
Mm-hmm.
and dry cough,
Okay.
um, and tachycardia, racing of heart. On examination, her her heart rate is 95. Blood pressure is on the lower side, and she had scattered wheeze and crackles in her chest with a hemic murmur in the heart, suggestive of anemic heart failure. She had darkening in the skin in her lower limbs and in her palmar crease. Um, my differential diagnosis, this Miss Dali currently showing anemic heart failure. Uh,
Mm-hmm.
with features of secondary hemochromatosis for recurrent blood transfusion.
Mm. Okay. And so, what is the differential for this case?
As I will put so currently I believe she had I think she has anemic heart failure.
Mm-hmm. Okay.
Um, yes.
What else?
What else? It could be pneumonia.
Mm-hmm. Okay. You told this may be secondary hemochromatosis, right?
Yes.
For what?
For recurrent blood transfusion.
Yes, and recurrent blood transfusion for what?
For I think it is sickle cell anemia maybe for her age and the
Yes,
way of being.
yes.
I
This
couldn't
is sickle
appreciate
cell
the
anemia.
spleen.
Yes, this is sickle
Sorry,
cell anemia.
is
Because
it sickle
this
cell?
is
Okay, okay,
yes,
that's
because
good.
this is no thalassemia phase. I didn't show you any thalassemia phase,
Sorry.
and also
Yeah,
I
yeah, yeah.
didn't
Mm.
put any image for thalassemia phase. Also, there is no hepatosplenomegaly, and usually
Yes, I
thalassemia
couldn't find the spleen here. So yeah,
spleen is,
it's
but the patient is pallor, jaundice, history of blood transfusion, history of blood cell disease. So
yes,
all going with hemolytic anemia, but not thalassemia. So this is mostly sickle cell anemia.
yeah.
So,
So in the chest, it could be acute chest syndrome as well.
mhm.
It's common with sickle cell anemia.
So how to investigate if this is sickle cell anemia?
So I will start by routine investigation, full blood count, and sickling test. I will find the hemoglobin low, looking for low hemoglobin, and I will check for double white counts as well and inflammatory markers to
Mhm.
exclude infection. I would like to do a renal function test and liver function test, and I would like to do um, I would like to do a chest X-ray, echocardiogram, and
Okay.
yes.
Okay. And how you will treat this patient?
So this patient needs admission because she's showing she has symptomatic anemia at the moment, and according to the investigation, I might give her transfuse some blood. Um,
Okay.
and for if it is if it is acute chest syndrome, she needs proper analgesia with morphine and a strong analgesia and IV fluids as well, and close monitoring.
Mm-hmm.
Uh, and yes,
Okay. Okay.
her saturation is 93 to 94, so she needs oxygen and
Yes.
monitoring.
Yes. Yes. Okay. Thank you, Dr. Dalia. I know that is very hard case. I know this, but
Mm-hmm.
because I took something like this also, and I'm interested in the case because it may come in different presentation. So
Mm-hmm.
yeah, I wanted to discuss it with the group here,
Mm-hmm.
uh, because I know that it's difficult case, and we must to practice more difficult cases before the exam.
Yes. Okay.
Yes. So sorry for.
It's a nice case, really. It's really nice case, like a brainstorming. I
Yeah.
didn't like encounter sickle cell anemia for a long time.
Yeah, because if you got like hemolytic anemia with no features of thalassemia or no features or no splenomegaly, hepatomegaly, so we can think about sickle cell anemia.
Yes.
And in this case, chest pain is pointing to the acute chest syndrome, presented with fever. I told you that she is feverish, and also just chest pain, crackles, wheezes, cough, tightness. All these symptoms is going with acute chest syndrome in case already with background of sickle cell anemia.
Yeah.
And yes, a second differential, as you told, it may be a heart failure, it may be hemochromatosis from myopathy. All this can be the differential, but the most important is acute chest syndrome because it need ICU admission. It need very good hydration, oxygen therapy. Also, sometimes they are in need for plasma exchange.
Mm-hmm.
Uh,
Yes. If not
some
responded
cases,
to
yes,
hydration, yeah. Yes,
also
but
Blood
the
trans
complication.
patient
blood exchange or transfusion exchange, not
Yes,
plasma exchange.
extend transfusion. But
Yeah.
the patient is showing features of anemic heart failure more than, because when I examined heart, like it's a cardiac wheeze most probably and the hemic murmur. So I felt the findings in the chest is more related to anemic heart failure,
uh,
more than the sickle cell.
bilateral wheeze and crackles. It's infiltration of the chest. Even if you do the chest X-ray for this patient, you will find bilateral infiltration, and also the fever and hemic murmur from anemia, not from heart failure.
Anemic heart failure.
Heart failure, I mean, yes, okay, but no obvious symptoms of heart failure. No lower limb swelling.
Shortness of breathing and just, oh, it's okay. Yeah, yeah.
Okay, so it's go more with this. Uh, and also, yes, like Dr. Hatim told, hemic murmur is sometimes is not with anemic heart failure. It comes with anemia only.
Mm-hmm, mm-hmm, mm-hmm,
Okay,
mm-hmm.
and the rapid is a sorry, the wide spread of wheezes and crackles. It's more common with chest, not
Syndrome,
if,
okay.
yeah, may be found in pulmonary edema, but it's not in the case here. Yeah. Okay, so investigation in this case we will do. You mentioned electrophoresis.
I mentioned sickling test. I forgot about what else for sickle cell
Yeah.
anemia.
Yeah. And all profile for hemolytic anemia like reticulocytosis,
Yeah,
haptoglobin,
yeah,
LG,
yeah. To exclude
globin.
others, yeah.
Yes. And
Mhm.
for this case, we can do also chest X-ray
Yes,
or
amazing.
CT scan. Yeah, and
Completely.
what
Mhm.
else? Echocardiogram, ECG to exclude other causes like this. Okay, well
Mhm.
done.
Thank you very much for the nice case. It's really nice.
Thank
Yeah,
you.
thank you, Dr. Phoebe. Seems today difficult cases from both sides. But
Yes.
we are learning from the difficult more than the easy case. And whenever you miss the case, you will learn more than when you catch the case. So let's start from the darkening. I read this question and I like, and I want to start with what is the indication of the darkness of the skin?
Blood transfusion.
Blood transfusion. So,
Take many blood transfusion before, so iron deposition and
okay.
skin darkening.
I think also we can look,
Hemochromatosis, but only skin darkening from
yeah.
iron. Yeah. Mm.
And in hemochromatosis, Dr. Najla, you will notice bronze skin, not darkening of the skin, bronze skin or tanning
That's
of the skin.
why. That's why I
Yeah.
was asking Dr. Dahlia what is the color of Miss Dahlia
Dark
to
only.
see to see if she's dark color it will be darker,
Yeah.
but if she's fair it will be like silver bronze color or some. You
Yeah.
got my point. That I ask
Yeah.
her what is the color of Miss Dahlia herself.
Yes.
This is
Yes.
not my question.
Yeah. Okay.
Oh, I think iron deposition is darkened, not bronze. Like,
Bronze
am I right?
skin in fair patients, it will be like a bronze color.
Mm.
Okay. Let's go to the point of presentation. You suspect heart failure, but I believe heart failure will be short of breath more than chest pain. The patient with acute pulmonary edema or acute heart failure or anemic heart failure, he will not have chest pain.
Uh,
Suppose he will have severe short of breath
mhm. She has
rather than,
shortness of
yeah,
breathing, and the pain is vague. Like she mentioned, it's all over, touching. It's radiating
yeah,
to both shoulders.
yes,
That's why I felt like it's not something localized.
yeah.
But
Also
yeah, it
sickling,
it, it suits.
yeah, sickling will present in this presentation. Sickling or acute chest syndrome. Also, in some cases, they also prefer to do CTPA, CT pulmonary angio, to rule out pulmonary embolism because also it might be a blood pulmonary embolism as a complication of sickling. It happens, so okay. So
Mm.
you can also add it to the investigation and imaging. Okay. Family history. I want to ask about family history. You ask about
Mhm.
family history, right?
She
Yes,
asked this.
yeah.
Yes. So why it wasn't
It's
conclusive?
supposed to be positive, yeah, in second.
Yeah. Yes. Dr. Phoebe.
The
Yeah.
doctor told that in my brother and sister, no one, but in the other family, I don't know.
Yeah. At
Because
least.
it is autosomal recessive disorder, so may it not
Yes.
come in the.
Exactly.
Mm.
Yes. Exactly. So it suppose at least the siblings or offsprings will have the disease, right?
Mm.
Either in the parents, the mother as a carrier. So
Yes.
at least the patient will say, I had a family history of blood disease in my family or in uncle. It's a common, I mean, to be presented in the other family member. Although it's autosomal recessive, you're right.
Mm-hmm. Not like thalassemia autosomal. لا, thalassemia is
Both of
autosomal
them autosomal
recessive.
recessive. Both of them, yeah, both of them
Mm,
autosomal recessive. Yes, exactly.
mm,
So they need to be carrier, mother and father carriers to have the disease.
mm,
If not, all of the kids will be carriers.
mm, mm,
Clear?
mm.
Okay, so I think also, Dr. Najla, you can specify the history of any blood disease in the family. I think so.
I asked Miss Dr. Bassem this time
Mhm.
cautiously. I asked similar,
Okay.
any family history of similar condition, any family history of any illness that I should know about. I think yeah,
Yeah,
because
I think if you
it is.
catch the clue, you can ask about the blood itself, blood disease itself. I didn't catch the case, by the way. That's why I was confused. Both cases today, as I said, both are difficult. Anyway, we are learning again from difficult cases more than the easy case. Yeah, because the debate and the discussion always make it more clear. You'll learn now how the sickler patient present as acute chest syndrome. Also, they might present as Dr. Phoebe said. It's this sickling or sickle cell disease can come in the exam in many way. Acute chest syndrome, pulmonary embolism, also acute coronary syndrome, a vascular necrosis of the hip, or hepatomegaly, yes, extramedullary hemopiosis, and of course,
Sequestration crisis in the
yeah,
finger.
succession crisis, joint pain, hemolysis or hemolytic crisis. These are the crisis itself as our presentation.
A plastic crisis as well they had.
A plastic crisis if there is, yeah, parvovirus infection. And don't
Mm.
forget, here spleen is not bulbable, as Dr. Phoebe said. This is the difference between sickle cell and thalassemia because of
Mhm.
autosplenectomy. Clear?
And Dr.
Yeah.
Basim, also in sickle cell disease, we can add in the treatment the hydroxyurea and
Yes,
also the
exactly.
okay.
Yes. This is for
Mm.
the chronic form. Yes,
Yeah. Mm.
exactly. Don't forget the hemoglobin electrophoresis, looking for hemoglobin S percentage. And according to the percentage, you can consider either blood transfusion or exchange transfusion.
Mhm.
Okay. Apart from this, hydration is the main or the corner say of the management, because any dehydration it will lead to the sickling infection. Also, avoiding all triggers are the main management plan in this patient. So avoid infection, avoid dehydration, avoid stress. All this will lead to the crisis. And
Yes.
yeah, and every crisis will be painful, as Dr. Najla said. Strong analgesia in the form of morphine. They are not responding to simple analgesia, no paracetamol and non-steroidal and so on. So only the required morphia as strong analgesia. I guess this is the case, and my comment. Anyone has comment here? You can raise it, please. Apart from the chat box, anyone want to say something, please? All of you are welcome to mention. Tramadol, yeah, according to the allergy, if some patient of sicklers have allergy to morphine, they are giving tramadol or they are taking tramadol accordingly. So it depends according to the allergy or the nature of the pain or pain management team. Okay, skin. Let's read the comments. Dr. Salma, from downward upwards. The skin and nail change, including nail hyperpigmentation, longitudinal bands, and hyperpigmentation of the palms and other skin surfaces. I believe you have here to mention the injection marks, not injection, or it's a blood transfusion or needling for the blood transfusion. Isn't Dr. Phoebe? Because this patient's always having recurrent blood transfusion. You
Mm.
can ask also Dr. Najla about any hospital presentation or any hospital admission before. Most of these patients are at least, if they don't have hemoarthroplasty, I mean replacement, hip replacement, they will have admission for hip pain or avascular necrosis. So
She's a young patient, and I
yes,
asked
surgery,
about
exactly.
surgery. I don't have an explanation. If Dr. Phoebe can explain for me
Uh-huh.
the palmar crease darkening.
Darkening.
If I
Again,
thought about pituitary infiltration with iron,
no,
but
no, she
something
said again the
the
same
bronze,
iron.
the iron deposition in palmar
Yeah,
crease.
In
but
Balmز Marquise يعني in Balmز.
yeah,
Mm-hmm.
but good question you ask about pulmonary hypertension, because whenever you find this darkening you suspect Addison, you have to roll it out, especially with the presentation of heart failure and hypotension.
Because hemochromatosis can affect like the iron can deposit it in pituitary and can
Yes,
cause like
sure, and yeah, it causes
yeah,
panhypopituitarism. Yes, you're
yeah.
right.
So that's why I'm just like, yeah,
Perfect,
like
perfect.
concerned
Yes,
why palmar crease especially is darkened.
yeah,
Mm.
perfect.
Yeah, yeah.
Okay, Dr. Salma also mentioned persistent and recurrent leg ulceration has long been considered the dermatological hallmarks of those with sickle cell disease. Anemic member doesn't mean by Dr. Hatem, doesn't mean anemic heart failure exactly. Anemia itself can cause what the darkening we mentioned already, but still she is safe, doctor. She admitted the patient for further evaluation. Of course, you have to admit any crisis, any sickler crisis, patient should be admitted. At least, if they will not do blood transfusion, exchange transfusion, they will receive strong analgesia and they will receive good hydration. You
Mm.
have to, you have to admit the patient. Okay. Exchange transfusion indicated in acute chest syndrome exactly. Family history I mentioned already. Glucose 6 phosphate dehydrogenase deficiency might be yes, but it will be related to food intake like protein, history of malaria and anti-malarial intake. It will be the clue in the case. So secondary hemochromatosis, yeah, already we know the case now. Thalassemia will be presented with splenomegaly. In contrast, our case has no spleen. Acute chest syndrome. Oh, Dr. Sarah know the diagnosis earlier, mashallah. Acute chest syndrome due to sickle cell anemia. She catch the case. I think she's the only one. So she's the winner today, Dr. Sarah Muhammad Ahmed. No one
Thank you
suspect
very
this.
much. Yes,
Yeah,
thank you.
yeah, well done. Really, all of us were confused, looking for the anemia, heart failure, MI. No one suspect acute chest syndrome due to sickle cell anemia. Perfect. You
Yeah,
deserve a practice in another day.
thank you very much.
Most welcome, doctor. Hemocrates give universal darkening, yes, as Dr. Salma said. She missed the diagnosis. I agree. Also, I missed the diagnosis, not only here. Dr. Ibrahim, she had blood transfusions. Yes, it was positive. I mean, anemia need blood transfusion with hemochromatosis. Yes. Okay. Yes. The general rule and again advice for everyone, please, whenever you hear and you auscultate crackles, ask the patient to cough. In both scenarios, both of you had crackles and no one asked to cough. Both of you will be minus in the physical examination. Please ask the patient to cough. Why? In the first scenario, you will know this is will not be cleared. In the second scenario, will be cleared. Got it? In the first scenario, due to fibrosis. In the second scenario, due to pneumonia or pneumonia-like presentation. So in the first scenario, the cough or the crackles will not be cleared with cough. In the second scenario, the crackles will be cleared with coughing. So please ask this question to show the examiner that you are looking for the cause of these crackles. Don't say, yeah, I got crackles. He will ask you what the nature of this crackle. What do you think about this crackle? You will miss the case if you didn't ask this question. And you might minus also the physical examination and identify the finding. Clear? Both of you, Dr. Phoebe and Dr. Najla, please, and everyone, not only you. Anyone has crackle in the exam, ask patient to cough just to look for the cause of these crackles, either fibrosis or pneumonia or pulmonary or fluids or bronchiectasis. All these are the cause for cleared crackles after coughing. Okay, I think all comments were read. Any comment from others? Anyone has comment want to share? Dr. Phoebe and Dr. Najla, please do more practice. You have to be more systematic, organized, and the opportunity for you. If you have near exam, it's good idea to practice again and again. You have the opportunity, and the priority always for those having near exam.
Yes.
Okay? Yes. Any comment or any question from anyone? Please, let's hear. Okay, if no one, we can end the discussion and the session. Can skin pigmentation and anemia coexist? Yeah, yeah, I think it will be. It can be. The pallor, it will be present as anemia, and the darkening in the creases or in the other skin areas. Thank you, Dr. Fazl Rahman. See you tomorrow, inshallah, with Communication Day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.